In the next chapter, we will talk about sub and supravalvular LVOT obstruction. It's a rare condition in adults, but it's important to remember these findings because they should not be mistaken for severe valvular stenosis, because the treatment is completely different. Subvalvular aortic stenosis or membranous aortic stenosis is a congenital malformation. It is the second most common left ventricular outflow obstruction. The membranous form can present in variable morphology and degrees. The membrane itself can be quite thick or just very thin, or it can be just a fibromuscular ridge. Sometimes the stenosis can even be tunnel-like, with a longer segment affected. Now let's take a look at supravalvular aortic stenosis. This type of aortic stenosis also belongs to the congenital malformations. Usually, patients present with an hourglass type, which is found in around 70% of cases. Or it can present as a membranous type with a supravalvular membrane in around 10% of patients. Some patients present with a tubular type, where a long part of the aorta ascendens is affected, and this is seen in around 20% of patients. So what actually happens when a patient has sub or supravalvular aortic stenosis? The membrane causes outflow tract obstruction, and the left ventricle reacts with hypertrophy due to the increased afterload. Frequently, there is also associated aortic regurgitation and turbulences in the LVOT. Let's have a look at this patient with subvalvular aortic stenosis. Here on the left side in the peristernal long axis view, you can clearly see this thick membrane just below the aortic valve. Let's take a closer look. Here on the right side in the zoom function, you can see this thick membrane here in the left ventricular outflow tract causing obstruction, and note also the left ventricular hypertrophy which has already developed in the left ventricle due to the increased afterload. Here again on the left side in the peristernal long axis view, you can see the color aliasing caused by the turbulences of the membrane and the stenosis. And on the right side in Doppler, we can appreciate the fixed gradient caused by the membranous stenosis. Here we have an example of a patient with subvalvular aortic stenosis who also has accompanying aortic regurgitation. Here on the right side, you can appreciate this almost circular membrane in the LVOT. Frequently, we encounter other findings in these patients. Quite often, there are abnormal mitral valve insertions, or these patients can have associated defects in more than 50% of cases. There can be a PDA, a ventricular septal defect, or as in this patient here, bicuspid aortic valve, or even pulmonary stenosis. In supravalvular aortic stenosis, other associated findings can be anomalies of the coronary arteries, or other aortic valve pathologies such as bicuspid aortic valve, or pulmonary stenosis, or even coarctation. So we have to examine these patients very meticulously to look for other congenital anomalies accompanying the membranous forms of aortic stenosis. So what are we looking for in the echo evaluation of these patients? We can find the typical features of LVOT obstruction, and we have to check out the morphology of the aorta and the aortic valve. Typically, there is color flow aliasing at the site of the membranous obstruction, and we have to be very careful when we see increased continuous wave velocity despite a normal aortic valve morphology. And we have to look very closely so that we don't miss out on a membrane or a subvalvular stenosis in the LVOT or a stenosis after the aortic valve in the ascending aorta. So now you've heard a lot of information about aortic stenosis, which is really one of the most important clinical entities in cardiology and also a complex one. In the next chapter, we will summarize the findings of aortic stenosis, and you can always go back to the ECHO Atlas if you want to look at more cases.